Welcome, everybody. We're here with a very amazing guest today that I'm extremely excited for you guys to meet and to hear a little bit more about what they do. Joining us today, we have Jenny Chiu. She is the Vice President of Product Marketing at Vivian. Welcome, Jenny.
Thank you so much, Chris. It's a pleasure to be here. I have no doubt this will be the best hour that I've spent my entire week. So super excited to be here with you, talking to all your clinicians and candidates who use your platform.
Thanks, Jenny. Yeah, we've been looking forward to this talk all week. Got to know you a little bit, and it's really exciting what you guys are doing over there. And I really am looking forward to our audience getting to learn more about Vivian. So why don't we start off, and why don't you tell us, Jenny, a little bit about what's your role at Vivian?
Yeah, absolutely. So as you said, I'm the Vice President of Product Marketing. And that really means that I have two primary responsibilities. First, it's doing things exactly like this, meeting with our customers, which for us means both the recruiters who use our platforms, but most definitely all the healthcare professionals on our site, and really teaching them about why Vivian was created, how to use Vivian, what are all the best practices, so that ultimately they're getting the most success out of the platform. And then second, from there, in having those conversations, I'm inevitably stumbling upon really great learnings around pain points that people are still having with the platform, things that they would like to see, improvements that they want to have made. And then I get the best part of being the advocate of all that feedback with our product team. And so really helping our product team then to build with our end users in mind so that we just continue to deliver the best experience possible.
I think first off, just to give a little bit more about, you've been a little bit all over the country, you have a great career, but why do you like working in the travel healthcare industry?
Yeah, I love this question. Thank you so much for asking it, Chris. So I'm a very mission-driven person. I like waking up thinking that I'm working on something big, important, that makes a difference. I'm a mom of two very young kids, 1.5 and 4. So I've had my fair share of hospital visits. I had both of my kids during the pandemic. In fact, my second kid, I had COVID when I delivered. And I just remember how scared and vulnerable I felt in the delivery room. My husband couldn't be with me. And it really was the nurses and all the hospital staff that kind of came to my rescue and made me feel safe. They taught me how to hold my baby. They taught me how not to be worried that I was going to pass COVID on to him. And I'm just internally grateful for all those people. And so I like going to bed thinking every night that those are the people that I'm helping every single day.
I absolutely love your why and that story. I feel like, most people, when they get to the point of getting to any type of healthcare facility, especially a hospital, we're usually at our worst. That's why we need care. And I think we forget that every single day, 24/7, nights, weekends, that they're there taking care of people, just like you and me. And I'm glad to hear, full circle now you are doing a big part to return the favor and help them back.
Yeah, thank you. Yeah, it's, once I think you've been through that moment and you see it firsthand, it's hard for it not to change your perspective on things. And so, yeah, just thank you to all the people who are watching this. I truly feel like, you have helped me through some of the hardest times in my life.
So let's say somebody has been living under a rock for a while and they don't know who Vivian is. I'm not sure how, but if you're in travel healthcare, I'm sure most people have. For those that haven't, can you just tell the audience a little bit more about Vivian?
Yeah, I mean, first, I wouldn't blame you if you were living under a rock. I think my mom is still learning about Vivian also. So we're not your 75-year-old grandmother, as you might think from the name, but we are the largest jobs marketplace dedicated to healthcare professionals. And what that means is you can go to vivian.com and see all the healthcare jobs centralized in one convenient place for travel nurses, for nurses looking for permanent roles, for allied professionals. And I love the analogy you made yesterday, Chris, when we were prepping for this call, is that when you're trying to book a hotel in New York, you go to hotels.com. You get to see all the hotels in one place. You get to see the prices. It's super clear and transparent for you. You can shop around. You can see the reviews. You can see all the features of what those hotels have to offer. And then you can book your hotel stay right from the convenience of that one site. And so that's what we try to do for healthcare professionals looking for jobs. We aggregate all the ones that we have access to onto our website. We make the pay super transparent, front and center. And then we give you helpful tools and resources like facility reviews, so you can get a little bit more insider's view into what that hospital is like. And then you can apply directly to the job on our site. And then we will connect you to the recruiter at agencies like Uniti Med, who really then can help you bring you over the finish line. And that's, to me, actually, that last part is one of the best parts of Vivian, is that through our partnership with agencies like yourself, we really try to guarantee that there's a human on the other end of your application. I think we've been there before, where you apply to a job on a website, you click send, you don't quite know where it's going and who's going to respond, and if at all. And, at the end of the day, it's humans placing humans. And so we really try to make that connection possible, which is why I'm so grateful for our partnership.
Oh, thank you, Jenny. I completely agree. A lot of times the human side gets to come in after, they apply for the job. And it's nice when we get these incoming apps. And like we said, that because it's out there, so many people are on there, they may be looking for options in an area and go, you know what, I have heard of this brand. Great. They've got great reviews. I'm going to go with somebody I trust. And they also, have the ability to kind of look through there and decide, do I want to try maybe this company? But once we get them, that's when really the human aspect comes in.
Yeah.
I just was listening to a call this morning that one of our recruiters made, and that person was interested on one of the jobs. But then we took the time to just get to know them. Who are you? Why were you interested in that job? And through learning their whys and what stuck out on that one, we were also able to say, well, here's some other jobs we also have on here that we think may even fit better. And they're like, oh, I just didn't know that area. I'm not familiar with it, right? And I compared a lot to clothes shopping, where you go into a store and in your head, you're like, I'm going to buy this blue shirt. And then you walk into this store and you walk out with not a blue shirt. You walk out with something completely different, but you didn't even know that existed until you walked into the store. And that's what our recruiters do, and go, well, why did you want that to begin with? And then go, hey, what do you think about this one? While you're looking at this one, we got these other new things out here that you might like even more than what you thought you wanted. And that's the human aspect of when you get to know somebody and their why, you're able to really show there's so many more out there, or things they may not even knew existed that they may like better.
Yeah, absolutely. You make that sounds like me every time I go into Target, and I come out with hundreds and hundreds of dollars of stuff. And and I really think that summarizes it well, because I think Vivian is a technology platform. It's a website and a mobile app, but ultimately what we're doing is empowering that human connection. I know we're going to kind of get into this a little bit later, but just a little interesting tidbit about Vivian. I'm not sure if folks know, but we're actually owned by a company called IAC, which is like a parent company. And they own a lot of other kind of websites like Match.com and Care.com, which is all about creating connections, right? Like Match.com, the dating app that had a lot of popularity. And we kind of think that's what we're doing. We are trying to make matches between healthcare professionals who are looking for jobs and their soulmates on the recruiting side, so that they can have that relationship to ultimately land that dream job of theirs. And so I think it's really appropriate what you just described.
I bet there's some people out there that may not realize Vivian used to have a different name. Do you want to tell them about that?
Yeah, this is one of my favorite stories about Vivian, and really goes back to our mission and why I joined the company. So when Parth, our founder and CEO, started the business, he originally called it Nursefly. We were serving travel nurses, and that name Nursefly kind of made it super clear that that's who we're serving. But as the company has grown, so has our offerings. We now help all types of clinicians, between nurses and allied professionals and others, find jobs across not just travel, but permanent, part-time, per diem, locals. I'm still learning all the terms out there, but we offer a wide offering of jobs for various types of healthcare professionals. And so we wanted a name to be broader to reflect that, and also to kind of highlight more the fact that we are mission driven, that we really are trying to put clinicians at the center of everything we do. So we went through a rebranding exercise about 2 years ago, and we came up with the name Vivian, which is derived from 2 Latin words. So the first part is Viv, VIV, which stands for life in in Latin, and then Ion, IAN, which means worker in Latin. And together they make Vivian, which is the life worker, and really symbolizes those who kind of give up their lives to help others live, really healthy, happy, prosperous lives. And we just thought that name so perfectly encapsulated that mission.
I absolutely love that. I didn't realize, and you got a chance to tell me that yesterday, but I didn't realize that's what the name meant. There was meaning. Sometimes you see some of these, and I hate to say it, and you're like, is it just a made up name or, a clever word? So I love how much thought went behind it. I think it speaks truly to what you guys are doing and who you're working with. And I'm also glad you guys did rename it. My wife, she's a respiratory therapist.
Okay.
And, so I talk to a lot of people she works with, people in allied health space, but I laugh because even if you work a lot of times in a lab or radiology or cardiopulmonary, they don't refer to themselves even as allied health.
Yes.
And then a lot of times they're like, oh, this website does do that, and it's called nursing. And so for a lot of people out there, they feel like, where do I search? What do I look for? So
Yes.
it was a great rebrand. There's so many healthcare professionals out there that do different variety of roles, and I feel like it's a lot more inclusive.
Yes, absolutely.
Going off of, the changing of the name and how that's evolved, are there any other behind the scenes stories that some of us just might not know about Vivian?
Yeah, I think, when I was first learning about Vivian, what you would do is you would Google Vivian and you would see our website. Maybe you would read the About Me section and find out about our company history. And you would see that we were founded by 2 men who at first pass don't have healthcare backgrounds. And so I love the story that you just told about your wife, because that definitely resonates with our story, which is that, Parth, the founder, he got the idea for Vivian after just grabbing coffee with a friend. That friend happened to be a travel nurse recruiter. And he was telling him about all the struggles about finding candidates and how he was combing through like Facebook pages and various Facebook groups. And it just took a lot of time and it was hard. And so that kind of got Parth thinking. He was a builder and a tinkler. He was like, it feels like something should be done to kind of create a better experience. And so after that coffee, he reached out to a friend, Eric Connor, who happens to be an engineer, and his wife, at that time, fiance, was a travel nurse. And so Parth then got to hear the other side of it, which is, yes, for travel nurses and now, more broadly, healthcare professionals, it is really hard to find jobs. Like they also have to comb through like a bunch of different sites. And like I said, the pay is not always super obvious. And so that really became the inspiration. Like Eric and Parth together, like in their tiny apartment, like sat down and said, okay, if we were to redesign this with healthcare professionals, recruiters at the center, what would a great experience look like to facilitate that match, that human connection, and helping that healthcare professional find the job of their dreams? And so that's where we got started. And today we are the largest marketplace wholly dedicated to healthcare professionals. We have over 1.7 million healthcare professionals on our site. Thank you to everyone listening who is a part of that community. We partner with the best agencies, large and small, like yourself, and we've helped thousands of people find the jobs of their dreams.
That's really impressive. 1.7 million healthcare professionals, and the amount of time you guys have been doing this, it's unbelievable. At the same time, I don't think it is because just like you shared earlier, it's I just can't remember the last time I just booked a hotel off of one of the sites. I may have some ones I'm loyal to. I may check to see if they're in a town, but if I'm going somewhere I've never heard of, there's just so much ease to going to a marketplace and seeing all the options in one place. Like you said, to not have to jump all around to figure out really what you want. So I'm not surprised by the popularity and how well it's doing. So Thank you for kind of sharing that. I guess, once again, I know there's still people out there that haven't heard of it. So let's say I'm a traveler or even looking to travel, maybe I haven't done it yet. What would I get at from Vivian?
So I would say there are kind of 3 or 4 primary things. The first is we really did start around this idea of transparency, specifically pay. We heard from many healthcare professionals that it was really hard to understand what that job was paying. Some agencies kind of don't advertise it, some do. Sometimes it's for the same job, it's for different jobs. So we just wanted to put that information like directly into the hands of the healthcare professional when they were searching for the job. So that was the first thing that we did. When we aggregated the jobs, we put the pay directly onto those job postings, so that there was hopefully no surprises for that healthcare professional, and they could really use that critical piece of information to inform, how they wanted to approach their job search. Next, with that information, we then also make it really easy for candidates to search for jobs because we've aggregated everything into one place. You can use our search filters to quickly sort through thousands of jobs down to the exact kind of location, specialty, shift of your preferences. And then you can save those searches and we will send you proactively job notifications for when jobs come up that match that search preference. So you don't have to be in front of your computer 24/7. You're working, you're on those night shifts. We will try to bring it to you on your terms. And then once you've kind of found that job and you really are ready to apply to it, we try to make the application process also as easy as possible. We created something called a universal profile where you go into Vivian, you create your account, you fill out your profile once, and then you can use that to apply to then all the different jobs that you're interested in. You don't have to complete an individual application every single time. And that information then gets sent off to the recruiter, who of course will do their own qualification screening. And there might be some additional pieces that are unique to that job that they still need to collect from you. But just having as much of that information centralized at the beginning helps that recruiter also just make it a much faster submission process for that clinician looking for a job.
One of you guys launched a new feature last year, and it was called the VIP program.
Yes.
You want to tell us a little bit more about the VIP program?
Yes, I love this program. This was actually the first program that I worked on when I joined the company about a year ago. The VIP program was purely designed to recognize and reward candidates for doing the things that they already are, which is searching, applying, and getting jobs. And so after the pandemic, we heard loud and clear that, like everyone, but clinicians especially who are on the front lines, were feeling really burnt out, and that the mental and emotional toll the past 3-4 years was really a lot to bear. And so we simply wanted to show our appreciation and just provide a little, thank you, a little token to just really acknowledge all the kind of hardship and just amazing stuff that clinicians did for us over the past couple of years and will continue to do so. And so that really was the heart of the VIP program. So as a VIP member, you get priority job alerts. So you get first dibs on kind of applying to those jobs. When a job opens up and it matches your preferences, we will send that to you immediately, kind of before others. We will also give you a badge that says VIP. So when you show up in the recruiter's inbox, they know, oh, this is a really serious, high intent, qualified candidate. Let me reach out to them and respond as quickly as possible. And then the best part, really kind of going back to that, just a reward and saying thank you. We also offer rewards, like cash rewards, where you can earn up to $1,550 simply for getting jobs on Vivian. So your first job that you find on Vivian and you get placed, you get $50. The next job you get $250, and it kind of scales from there all the way up to, in total, $1,550, which is nice. Nurses have told us that they've used it to do their morning coffee runs. Someone bought a porch lamp to fix in their backyard. Another clinician was doing her assignment in Washington, and she used that $50 to kind of splurge on a meal for herself. And so it's just those little things that we want to do as much as possible, again, just to show our appreciation to all the people who are working so hard to help others.
I love the reward program, and I don't want to gloss over what you also said just on them allowing them to put in their preferences and getting job alerts. I think
Yes.
that's really important too. Is it's hard when you're out there looking. Jobs just they're opening and closing every single day, and so some of the really high demand jobs, can open. And if somebody was waiting to get on a website and look for themselves, there's a good chance it could be closed before the next time they get on the website. So having that ability to say, hey, we know you're looking for this just opened. If you're interested, I'd apply right away. So I don't want to gloss that over. I think that is another really great thing about the platform that allows them the best chance to get the jobs that they really want. Would you say that, downloading the app, getting their profile ready and updating everything, would you say that's your number one tip for using Vivian? And if not, like, what would be your top 5 tips for people using it?
Yeah, those are definitely up there. I think first and foremost, when you sign up for Vivian, download the app so that you can get those alerts on your phone and be able to respond really quickly. Complete your profile so that you are providing that richness of information to the recruiter, but then you also do it once, right? So that you don't have to then fill out all that information over and over again for each subsequent job that you're trying to apply to. Update your preferences. Keep that as up to date as possible. I think some clinicians, totally understandably come to our site, they set up their preferences once, and then they kind of forget about it and don't come back. But over the course of your life, your life changes. At one point in time, you were really open to just this one location because your family was there. But since then, people have moved around and you're now open to like 6, 7 other different cities. Make sure you're going back to Vivian to update that, because again, all that information is sent off then to the recruiter who's trying to place you, and they can give you a much wider variety of jobs then. Another thing that I would recommend is once you are serious about applying to a job, you do have the ability to also complete what we call our skills checklist. And that really is required for most submissions. The recruiter has to put together a very robust package about you to send over to the facility. And the skills checklist is one of those documents. And so we try to make that really easy on our site too, where you can upload it onto Vivian and then send it off directly to all the recruiters and jobs that you're applying to. And then lastly, yes, absolutely join the VIP program. It doesn't require much. If you've already done those 3 steps, you've downloaded the app, you've completed your profile, you updated your job preferences, you get to be a VIP. And then when you get that first job, you can start getting those incremental cash rewards.
Yeah, and I don't know anyone that doesn't love free cash. So I guess speaking of that, with all that Vivian's done and the growth it's been having, what are some things that you guys have learned over the last few years?
Gosh, like I said, I'm brand new to the industry. I started at Vivian in April, and so I'm drinking like a fire hose every single day. I think, we talked about the jobs opening quickly and opening and closing really quickly. I think we've also learned that healthcare professionals, they care about pay, but they care about other things. They're also looking for kind of balance in their lives and kind of filling up their own emotional and mental wellness and the kind of constant thirst for like community. And so those are things that we're also really focused on, kind of like in the next set of things that we build at Vivian, is how can we provide more support on that end. So right now you can go to Vivian and find reviews about all the facilities. And those are both reviews from peers, as well as other the people who worked at those facilities, as well as reviews that we've been able to gather from like other sources, just again, to put like more information for that clinician who's looking for a job. And then we're really interested in exploring areas around mentorship. We just had, I think it was Healthcare Wellness Week, a couple of like the first or second week of January. And we created a first version of our mentorship program where we were connecting first-time travelers with more experienced travelers, because it's quite daunting to do traveling for the first time ever, right? You got to figure out your housing and all the pay and like the location. And so really being able to pair that person also with somebody who's done it before, I think goes a long way. So those are some of the things that I've also just learned about this, like really, really like unique part of the healthcare industry.
That is really amazing. I love how much you're thinking about, like you said, what's hard about travel staffing, especially for a first timer. And the mentorship is a really great idea. And like you said, building that community. I laugh a little bit inside. That's part of what our where our name comes from, is the Unity side of that. But
Yeah.
it's true. One of the things we quite often hear from the travelers is sometimes they can be in it. It's an area that's new to them, and they have to get to know people right off the bat. And a lot of times, there's actually a lot of other people doing the exact same thing in the same area, but they don't even realize that, or maybe know that. And so, I think that's one of the biggest, and can be scary things for a lot of people that do it, is just getting out there and the ease of getting to know people and feeling like you have people to hang out with and talk to when you need something. So absolutely love that is one of the things you guys are working on. So I guess some of the things I would also like to know is, how do you decide when you guys are going out and, let's say, building mentorship community, and you're thinking about your strategy and future release programs? Why did you create the universal profile or VIP? How do you guys make those decisions?
Yeah, it really kind of goes back to, how I was describing my job. It starts with conversations like this, really talking to our users and customers. That's recruiters and healthcare professionals alike, and really just kind of understanding their pain points, right? On the healthcare professional side, we actually go, a step further. We employ a lot of clinicians at our company. So clinicians actually are at the center of quite literally everything we do. I think I can personally attest that almost every single person at Vivian either has a connection to a healthcare professional, if they are not one themselves. In fact, there's literally a woman named Nurse Rachel. Like, her email is Nurse Rachel, her Slack is Nurse Rachel. That's what we call her internally, is Nurse Rachel. She's a registered nurse, and she was like employee number 5 or 6. And so she's been with the company for like about 5 years. And she started off first by writing our blog. So writing a lot of the content about Vivian to create that connection. And then just her wealth of knowledge. I think she spent 15 years as a skilled ICU nurse. And so we've taken that knowledge and we've put it into literally everything. She's a part of our business operations. She like literally manages our support team. So if a candidate has a problem and they kind of click the contact us button, it goes to other healthcare professionals, who then is managed by Nurse Rachel, who then responds to those questions. And she also leads our user experience team, so that when we are coming up with those new features, she actually does the interviews with candidates and recruiters to understand if it's working or not. So she's just like a huge kind of source of inspiration for our team. But we also employ clinicians across a whole other variety of jobs. They're on our customer success team, they're on our sales team. They really do fuel, I think, a lot of the innovation that's happening at our company.
I absolutely love that you guys do that. It shows, I think, in your work that, using clinicians, healthcare professionals, those that get it, that understand it, they work in there to help really make these key decisions and be part of your guys' DNA. We actually do a lot of that here. We have a lot of recruiters that, are nurses, nurse practitioners, other variety of healthcare roles. And there's something about that. Some of them, were travelers themselves. They went around the country helping out, and they did that. And, now some of the recruiters may get connected with is somebody that can share their stories and their experiences, and they understand how hard it can be. And they're really able to help guide you on what's it like when you're you're working on finding the place to stay at, and things to do. So I don't know if you can talk about this or not, but do you have any plans for the future that you can share with us?
Yeah, I'll do my best. We're laser focused on our mission, which is to help healthcare professionals connect with recruiters to find their dream jobs. And one interesting stat or data point that I learned recently was that 52% of applications, so more than half on Vivian, are happening after 6 p.m. So that means either a recruiter has to work at night and on weekends, which is what our nurses do and our healthcare professionals, or that clinician doesn't get a response because the recruiter is having dinner with their family or something, right? Understandably so. And so that there's just like a lot of misconnections simply because of this like scheduling conflict that happens between healthcare professionals and the recruiter. So we want to try to tackle that because again, we want to make sure that there's a human on the other end of that application and that we are trying to connect you with the right recruiter as quickly as possible. And then we are, just responding back to candidates. So we are investing, like most companies, heavily into open AI technology. And a great use case for us is to create that virtual assistant powered by AI to help answer those candidate questions when the recruiter isn't online. So imagine it's 2 a.m., you just got off your shift, you finally get a break to apply for jobs. So you send off that application, but it's 2 a.m. And so that recruiter isn't available at that point. Now, some are. I'm sure there are people at Uniti Med who actually are like truly on at that time, responding back to candidates. But we want to provide the option to both the clinician and the recruiter to say, you know what, I actually can't respond right now. I'm going to delegate that to this new virtual assistant who can answer really basic job questions around how much is it paying? Where is the location? What are some of the qualifications I need? What are some of the documents that I need to provide? Some of that kind of just like information gathering, the virtual assistant can do for you while the recruiter is on their break. And then we can also schedule a call with that recruiter so that as soon as they're back online, they can talk to that candidate immediately and we can facilitate that human connection. So this is kind of still in the works, but we're actively working on it, and we are excited to kind of ship its first version in the coming months. And so we'll be, desperate for feedback for everybody who gets access to it. So please keep that, send that my way. So that's one big thing that we're working on. And then the second is on expanding our VIP program. We're very serious about making our clinicians feel recognized and rewarded. And so we really do want to add more and more components to that reward section. So in addition to cash, what are some of the other things that we can provide, whether it's around community or mentorship, continuing education, like other things that we can do to make sure that they feel, again, appreciated and recognized.
Those are great plans. And you can really tell how much you guys care at the clinician level, really focusing on rewarding them, taking care of them. And you've said the word multiple times now, but you keep using friction. And I absolutely love that, taking out anything that, doesn't make the experience, seamless. And so I really love how you talked about the open AI. I know at a recent staffing conference, you guys got to talk a little about there too. And me personally, I'll share my own experience from my wife. My wife works does a lot of night shifts, and so there's breaks both maybe at work when she has downtimes. There's times that she just has a different schedule that maybe some other people do, and so I mean she'll be on there and have friends asking questions like, "Hey, want to know about this job and that," and like you said, there's not always somebody awake or there to maybe give them that, but they want it right then and there.
Yes.
So I love how you guys are looking at what are those type of questions, what do they want to know, what are the things that are keeping them from getting what they want to know, and how do we leverage technology, keep making the experience so we can try to give them that without them having to wait till the next day.
Yeah. Exactly.
And by that time, they might already be sleeping.
Yeah, exactly. That's the point, right? By the time the recruiter is up, then the healthcare professional is sleeping. So really is this ships passing in the night scenario, which is like, so, it's just like, you can solve it. It's not like for bad intentions or like, it's not because people don't want to pick up or talk. It's just literally different schedules.
It is just different schedules. Jenny, I guess to close out, is there, any one thing that you just really want to make sure everyone knows about Vivian that maybe we haven't talked about yet?
I hope that people take away that, Vivian really is a place that really cares deeply about healthcare professionals. We take our mission really seriously. We've created the largest jobs marketplace rooted in transparency and easy to use. And we partner closely with recruiters to make sure your applications are seen and prioritized and that there's a real human on the other side. And then lastly, to join our VIP program, because to your point, $1,500 is waiting for you out there.
Yes. And I think absolutely great advice. I guess to close out, I just want to make sure I say that, Uniti Med, we really appreciate our partnership with Vivian. You guys are one of the largest sources for us for a lot of the people that we're currently working today. And you bring a lot of people to us that, may not had known we had those jobs and knew about us had we not had our partnership with you. So a huge thank you to all the Vivian team. And it's just been absolutely a pleasure doing this with you. Your passion, how much you care about healthcare staffing has been absolutely amazing, to say the least. So thank you again for doing this with us. I really hope everyone takes a chance to make sure, if you haven't already, you go to Vivian and check out their website.
Thank you so much, Chris. It's been a pleasure. Definitely, like I said, best part of my week so far.
Yes, absolutely agree. Been looking for this all week. Thanks, Jenny.
You're welcome. Bye, everyone.